Hello everyone, it's Jamie Liptan with Portland Myofascial Release. My colleagues, Corey, Rachel, Spencer, and I want to say hello to everyone. For those of you that we get to the privilege of seeing regularly, we miss you very much. We, in the coming days and weeks, are going to be offering you through video some self-treatment tips and techniques to try to help you along in this very challenging time to stay open and soft in your body. We will be treating ourselves right along with you. We have had the privilege to learn from our teacher, John Barnes, these techniques that we use to treat ourselves, and we are going to offer them to you so that you can come through this time beautifully. Hi there. So the first technique we're going to show you is what we call a chest opener. So often in our modern society, but especially now that we're all at home, sitting on the couch a lot, and not being as active and out and about, we spend a lot of time slumped forward in our bodies, don't we? So this is an attempt to counteract that, to open up our system and allow for our spine to properly align, allow room for our upper belly and chest to expand and contract naturally. So I'm going to use a half foam roller. It's just a normal 6-inch foam roller, but cut in half, but you can use anything. You can use a rolled up bath towel, rolled up yoga mat. Some people use a pool noodle. Anything that you have around the house will work just fine. So I'm going to lay this out like so, situate myself so I'm centered on it, make sure my head's supported. If you don't have anything long enough that you're using to go from head to tail like I do, then you can use a pillow to bolster your head. You just want to make sure you're not like squishing your neck. So I'm going to align myself down the center of my body on my bolster, open my arms like so, and allow myself to soften into this place. You'll start to feel your shoulders drop that way, down around the bolster. You'll start to feel the stretch all the way through down to your hands and fingers. If this all feels like too much of a stretch, it can really be helpful to put something, a pillow or something like so, under your hands to lessen the amount of strain. But really feeling yourself just softening into this place. You don't have to hold yourself at all. So feeling all those little ways in which you hold yourself up just kind of melt away. And just like all the self-treatment that we teach you, we hold these positions for 5 minutes at least. It takes that long for the fascia to have a meaningful and lasting release, really softening into this place. So that is the chest opener. And I really encourage people, especially at this time, to do this daily. I like to do it before bed. It's a really good way for me to kind of usher in relaxation and softening. But some people like to greet the day with this. Start their day in a nice open, fluid place. Either way, or some other time during the day, it's really good to have this kind of daily both time and counteraction of all of that scrunching to the front. So that is the chest opener, our first treatment tip for you. So the next self-treatment tip is around this area, the solar plexus. So we've just done the chest opener to open up this part. We got some of this, but right now we're going to kind of dive into this tension in the center of our bodies. So as we do that scrunching, we also, we bring ourselves in the front of our shoulders, we tighten our chest, but we also tighten this area. So under here you have your diaphragm, which is, of course we all know is very involved in breathing and being able to get a full deep breath. And sitting right on top of that is a bundle of nerves called the solar plexus. And it tends to be an area of real tightness and restriction when we're stressed out or when we're slouching. So for this technique, we're going to be compressing into it really gently. We like to use these. If you've ever been to our clinic, you've gotten one of these little red balls. They're soft, they're inflatable, but more importantly, they're deflatable. So you can make it as soft as you need to make it to really be comfortable in this. We are not going for really mechanically getting in there and trying to break something up. We're going for melty soft, really softening over time rather than trying to break up something with force. So if you don't have one of these balls, you can use really anything that feels right for you. Some people will roll up or fold up a washcloth or a hand towel. If you have a much softer ball, or a bigger ball, excuse me, just deflate it a whole lot. You can use a small pillow that you can kind of scrunch up and get in there. So basically, we're going to lay into this ball really gently here, and I'll show you some modifications that we can do if that feels like too much. So the surface you lay on is also going to make a big difference. If you do this in bed, your ball or whatever you're using is going to get swallowed up by that pressure. So you just have to keep that in mind and either inflate your ball more or use something a little bit bigger or firmer if you're doing it in bed. On the floor, on a yoga mat, it's going to be a little firmer than in bed. So we're just going to place this on the floor and bring ourselves down into that area, just on the inverted V of the ribs, just in that kind of, that place in the V. Really just allow ourselves to fall onto the ball. I can already feel just with this little bit, I can already feel my mid back opening around this pressure. Now, just laying directly on this pressure, even if we soften the ball a lot, might be too much for you right now, especially. So I can bring this knee up and soften. It kind of pulls my chest and my pelvis up a bit and relieve some of that strain. I can try the other knee to get the other way. Or if all of this feels like too much, I can take my ball or whatever I'm using and just lay on my back, find that space here, put both hands on top of the ball, just allow the weight of my arms to gently sink into this space. And with all these techniques that we are sharing with you, you want to be in this, once you find that place and the position that feels right for you, you want to be there for at least 5 minutes. It takes that long to get a meaningful and lasting release with the fascia. As we release this, you'll be able to feel a whole bunch of space created in there for your diaphragm and really allowing breath to come back into your body and to support and nourish your cells. So that is a solar plexus release. Again, leave us any comments if there's something you're looking for help in your body, and we'll try to respond as well we can. Or you can find more information about us and contact us at portlandmfr.com. We'll talk to you soon.